I don't hear that Dawn or Darren are on the call, so welcome. Today's webinar is hosted by DBHR through the Washington State Healthcare Authority. Interactive, we're going to be I'm going to be asking for some feedback in the chat, or raise your hand and unmute your mics when you're wanting to say something. The slides for today, as well as the link to the recording of this webinar, will be sent out to you by email. So look for that. Thank you for everyone introducing themselves in the chat. I think we'll get started now. And if you could just keep an eye on those microphones to make sure they are muted. I'm hearing a couple of people unmuted, so that would be great if you could mute yourselves. I'll try to catch it when I can, but I may not be able to. So just take a minute right now to look at your screen to make sure you're muted. Thank you.
That's the first one.
Melissa, I think it's Melissa McDonald. If you could mute your mic, please.
Actively looking for housing and engaged or maintenance with just no.
She's on twice, so I'm thinking there you go. Okay.
All right, here we go. Let's get started. So words are powerful, right? So we're going to talk about how language and the use specifically of strengths-based language into career services has a huge impact on service delivery and potentially outcomes. Specifically, we're going to talk about, I'm going to just go through this quickly because I want us to get to our objectives. We're going to review the person first language approach, kind of talk through what that is, provide some examples, also how is it relevant to career services, and then kind of a similar vein is this idea of illness identity, and not that language is the only component that contributes to an illness identity, but it's certainly an important one, and it's certainly one that we as providers can address with our own language, advocate to others that we might be working with for them to use language that's person first and strengths based. And then finally, we'll recognize and reframe language that is consistent with a person first approach. So I skipped some of those beginning slides because I want to make sure we get to our content and have some time to fully discuss strengths-based language as it pertains to career services. Those beginning slides, if you're familiar with the Job Developers Call, we use some of this time, mostly every call, but certainly we try to address in many of the calls any challenges that you're all encountering, any successes that you want to share with the group. This learning community is designed to really provide that peer support to one another. So we do spend some time going over successes and challenges, and this is a pretty packed training, so we will save that for the end if we have time to get to it. So let's get started. We're really hoping to build engagement and enhance service provision through advocacy with our language, right? As these objectives describe, and just to follow up, we want to really recognize that our words as employment specialists, as counselors, convey a message oftentimes to people that we work with. We don't want to really create language and bathe individuals, if you will, in language that creates permanent and lifelong identities of illness identity. My colleague, Amy Banco, with the institute that I work with, has done a lot around this, and I'm using some of her, resources and materials. So I just want to want to let you know about that. But as we're kind of getting started, I want you to consider a time when you were making some type of change or movement toward a goal, and similar language to that which is listed below was used by someone you talked to about your change or goal. And the statements might have been things like, oh, you're not ready. Oh, that's way too stressful. You're too symptomatic, or you're not stable enough to pursue that change. And think about, what did you feel? What impact did this leave on your beliefs about your skills and abilities? So before we get into the meat of the impact of language, consider a time, and you don't have to disclose what that is, but we are going to sit here for a minute, and if you would like to share, feel free. If it's something you would want to share with the group here, we can certainly benefit potentially from.
You're welcome.
Would anyone like to share? And again, if not, think through some of these.
I don't mind sharing.
Teresa, thank you.
Yeah, no problem. I'm gonna change my screen. Actually, my mother was my siblings and I refer to her as the queen of verbal abuse. And I know that sounds horrible. I did really love my mom, but she would always knock us down, and we
Okay.
were constantly told, you would not be able to achieve that. You will not get there. That is beyond your scope of doing things. And it was just this little, like, this thing that came from mom that just hurt. It just like,
Mhm.
gee, mom, I'm trying to accomplish this, and everyone else is telling me I'm really talented. I can do this. I can make this happen. But your own mother saying that to you, just knocking you down, was always very difficult to hear.
So you felt defeated.
Mm-hmm.
And what impact, and again, if you don't want to, follow this up, but what impact do you think that had on your beliefs about your skills and abilities?
I actually moved 1,200 miles away from her and started over a whole new life in Washington State 20 years ago. And that's what made a difference, is I got away from that verbal abuse, that knocking down. That was the impact. I made a huge difference. And because I got away from her saying things, or I would not share with her what I was trying to achieve or what I wanted to get done in my goals in life.
Thank you for sharing, Teresa.
Yeah.
Anyone else want to share a time when you were making some kind of change or movement toward a goal, and similar language, like, you're not ready, that's too stressful,
I can share.
Oh, thank you. Is that Julia?
Chelsea.
Chelsea, okay, Julia also raised her hand, so.
Julia can go first if she wants to.
Oh, no, Chelsea, that's okay.
Okay. So I am starting a master's program, and I also work full time, and I hear a lot of comments from people about, it's so stressful. How are you going to do that? I wouldn't be able to do that. And it really has had an impact on me, because it's really made me start to question, like, oh my gosh, maybe I can't do this, to the point where last night, as I was driving an hour down south to the mandatory orientation, I thought about turning around and then just saying, forget it, I'm just gonna withdraw from this program. So I felt really nervous and anxious about it. Luckily, my supervisor is incredibly supportive, and I messaged her and I was like, I'm panicking. And she was like, listen, you can do this. You got this under control.
Great. So you followed up with someone who you knew would really promote your strength, right? Really
Yes.
provide you with that positive reinforcement and feedback. You knew calling your supervisor was something that would help you feel and have a better belief about your abilities to do this. And you went, I'm assuming.
I did, and it was really good. I feel a lot better about it now.
Yeah, great. Julia, would you like to share? Thank you, Chelsea.
Sure. Yeah, very good, Chelsea. Congratulations.
Yes, yes, big congratulations on that.
Indeed. So when I was in my early 30s, I had been already studying a particular dance technique called Nia. And I was having one of those, breaking up conversations with my boyfriend at the time. And I told him I wanted to be certified in the technique. And he said simply, "Oh, your dancing days are over," in my early 30s. And I took that, and every moment I was in that training, and for the 15 years I taught dance classes, and I'm not right now due to an injury, but my dancing days were not over, and I'm 53 now, and I'm still dancing.
Great, wonderful. What impact or how did that make you feel when you said that?
It made me feel that he wasn't right.
Hmm.
I just knew immediately that it wasn't true, and I was able to realize that's his own perspective. And I follow through with that day to day as I go along. Is like I'm the one who really knows what days are over or not for me, and yeah, builds my confidence to know when I hear something that feels right and or not.
So you were able to reframe what
Mhm.
he was saying to, no, I know myself. I know what my skill levels are, what my abilities are. I know when it's over, when it's not over.
Yep,
Great.
indeed.
Thank you for sharing. It looks like
Yep.
we have a couple of chats, chat discussions. So Melissa is writing, I think, in follow up to what Chelsea had mentioned. I'm in a master's program while working full time. You can totally do it. So yes, hearing from others, that it's possible, kind of helps with our own self-efficacy, right? And belief that something can be achieved. Jamie wrote, I completed a master's program, worked full time and had small kids. You can totally do it. You have to believe in yourself. The fact that you applied is winning, Jeanette mentions. And then Chelsea, thank you for us. Yes, so that support and positivity. Maybe some of these people on the call are people Chelsea, maybe not, but having people kind of believing in you and using language as a part of that, using words and the way that we refer about with someone, how they're referred to. When we're talking with other providers, how do we talk about the person that we're working with? Is it in a strengths-based way, or is it negative and always focusing on deficits? So we're going to thank you all for sharing that information. And I wanted to really kind of hone in on this idea that language can impact us in a variety of ways. Many of you heard different language from family or friends, and it impacted you to move forward and say, you know what, I know myself. And then others kind of heard messages in the language that was spoken to them about their skills and abilities, and kind of internalized that, and it impacted their belief in their ability to complete a task or go back to school or whatever that might be. So the impact of language, diagnoses, the labels, the labels of many diagnoses originated during the medical model kind of paradigm, and it conveyed a lot of defectiveness, right? Incompetency, inability, disparity, guilt, or blame. Like a lot of it was kind of charged with negativity and deficits. A lot of times in our, when people use pejorative statements and other language, it kind of strips people of their humanity, right? So when we think about different slurs or other types of negative ways that we might refer to individuals. It's done and it's designed to really impact that person, and we want to make sure that we are using language to build people up. And I'm not suggesting that you're, out there using really inappropriate, awful language, but sometimes the nuances, talking with other providers. We want to use language that's person first, builds people up. It goes deeper into our attitudes towards others and how those attitudes translate into actions. The label or identification that one's disability receives from a doctor is just that, a label. It's a way to broadly characterize a group of symptoms under something that's recognizable and universally used. So, sometimes the system, the diagnostic system and such. So when we think about person first language, what would be an example of the use of person first language? So just to kind of talk about it here, philosophy of putting individuals before their health condition, emphasizes a person-centered approach, a person with instead of the diagnosis first. And it's about more than just language, right? What would be an example of person first language that you might use when referring to someone that you're working with, maybe to another provider or to other people that are supports in their lives? You can unmute or use the chat. Okay. A person with a substance use disorder, absolutely, instead of addict. Yes, Chelsea. So we want to, what's the connotation? If you're referring to someone as an addict, versus hearing a person with a substance use disorder, what's the difference with that? What does it sound like to you when you refer to someone as an addict compared to a person with a substance use disorder? I'm seeing some more in the chat as you kind of think about that response. A person with schizophrenia, Dawn writes. A person experiencing homelessness. Yes, I've also been seeing, instead of homeless, unhoused, a person who is unhoused. Justin is talking about the difference is the paradigm of empathy. Yes. Justin, would you want to spend a minute or two unmuting and talking a little bit more about that, or writing that in the chat?
Yeah, so I'm somewhat conflicted sometimes with language because some of it is used as euphemisms to disguise what's really needed to be said. And so over time, some of the things that we do, I think a connotation will be associated with something, and that's when a change needs to happen. So for this use of like addict over time has become this thing where like you're a bad person if you're an addict, and that's not true, right? So changing the words does not change the condition, and that's where the slippery slope starts, right? But what it does is it allows people to view things in such a way where they can, through the prism or the paradigm of empathy, instead of this adversarial almost tactics that people use, or to reaffirm their own uneducated beliefs about something. And so they'll just try to go down this I don't know, almost down like a path where it's easier to say something bad about somebody. Right, and where it starts to get wonky for me is when language uses this idea of somehow if you change the words, you change the condition. And that's like I think the point of of almost no return at that point, right? You start to get to this idea that if we just change the way we say something, things will be better. And I think it actually helps people in the long run with the services. And so it's kind of this pronged thing. But I really like the idea of changing language to elicit empathy,
Mhm.
because I think we
that-
get kind of lost out in all that, and especially when we get this like sterile clinical speak interwoven into case management services or direct services. I think it makes this it creates an unnecessary barrier.
we have a lot in the chat, but also to just kind of highlight what you just said about empathy is person first language emphasizes person-centered approach. Empathy is one of the key conditions for a person-centered approach. And I think that what you're saying, Justin, is really just follows up nicely with that. Addict, Dawn writes here, addict sounds like they can't change. Person with a substance use disorder focuses on the fact that they are a person first and seems less negative. Absolutely. A person is not their circumstance or condition. Tatum writes, using person first language can alleviate the stigma that disabilities and other conditions have over an individual. Shifting to person first language puts someone's humanity first and makes a growth mindset mentality more achievable. And then Janice writes, I think NAAA still might use addict. I hear people describe themselves as an alcoholic or addict, though we should not refer to these individuals this way. It is up to them how they refer to themselves. Absolutely. We're not here to mandate, that others, individuals participating in services change the language that they refer to themselves. They're, certainly we can educate and provide information, but if that's how, just like you were mentioning here in the chat, that's how someone chooses to describe themselves, then that's their prerogative and choice. We just want to make sure we are focusing on the person's strengths and helping them see what their strengths are. In psychiatric rehabilitation services, a core principle is a strengths-based approach. Rather than looking at deficits or disease solely, psych rehab focuses on a person's strengths instead of just looking at what the person can't do, what the person's inabilities are, or deficits might be. We're using an approach that really focuses on person's skills, what they're good at, what they're interested in, what their capabilities are. It's collaborative. It's a partnership, right? So recognizing that the person themselves are the expert. They, just like you just mentioned about someone who might be an NA or AA and may use terminology that may conflict with our language, right? They might use the term addict or alcoholic. They're the expert in their own recovery. And they're responsible for their own recovery. Another key psychiatric rehabilitation, and quite frankly, in many counseling professions, people have the capacity to learn and grow and change. So using language that reinforces that ideal that people can learn and grow and can change helps to facilitate that. In your responses a bit earlier, when you're reflecting on your own change and what some of the language that others said, that certainly didn't sound like those individuals were necessarily working under this frame of people having the capacity to learn, grow, and change. Helping activities in naturally occurring settings. So, in environments where the person is going to be using the skills. So that's all strengths-based. So getting out there in the community, like you all probably do it in your roles as employment specialists and vocational counselors. A lot of your work is probably in the community, and the entire community is viewed as this oasis or opportunity for potential resources. So really helping the person access those resources and supports that are in the community, not just supports that are within kind of an agency or only designed for people with disabilities or mental health conditions. Strengths-based approach really focuses on what is out there in the person's community naturally, and how can we help that person achieve, kind of achieve recovery through using some of those resources. Janice writes in the chat, responsive listening and communication. Absolutely, another key part of a strengths-based approach. Really listening, showing the person you're listening. How do we show someone we're listening in career services? What or any of the vocational counseling that you're providing? How do we demonstrate from what Justin said, that empathy or that listening ability? Maybe you're reflecting back, you're using affirmations and so on. Let me see, I hear something in the chat. Yep, Stephen, eye contact, small responses to show engagement. Yes, so maybe head nodding, right? Eye contact, an open stance. So you're not kind of closed up with your shoulder, arms folded, you're open and you're relaxed. So let's look at how career services providers can be really key in helping individuals participating in services, job seekers, move from an illness identity to an identity of a student or worker, through promoting language that supports, through promoting language that supports positive identity development. So now let's take a look at illness identity and how it's defined, as well as kind of looking at how we can incorporate language into our career services that support those roles as worker and those roles as students. So Phil Janos and David Rowe have done extensive work around illness identity. One of the professors here in our department, Dr. Bill Weiner, has also done some work around illness identity. And Phil Janos kind of contends that there are two key ideas to the illness identity model. First, the person's diagnosed with a mental health condition, experience symptoms, and they interpret their experience of having an illness, and they assign meanings. They assign meanings which impact hope and self-esteem. And then secondly, the internalization of these meanings can kind of like infect, if you will, can kind of taint their own constructions of illness and can damage hope and self-esteem. So you're kind of looking at it, you can either be promoting self-esteem and hope, or you could be the person can internalize it and it could really damage and impact their hope and optimism for the future. So it's defined here as a set of roles and attitudes that a person has developed in relation to their understanding of having a mental illness. So as the individual come to believe that the diagnosis represents a challenge that can be surmounted, thereby leaving hope and self-esteem intact. So kind of thinking about some of the experiences that you all mentioned earlier, some people were like, I know I'm a dancer. I know I can do this. I know that I can move into successful positions. It doesn't matter what my family says or other people in my life say. So making the shift from illness identity to positive role identity is critical, right? It's because we want to encourage that hope, and we want people to build self-efficacy and a belief that they can achieve important roles in the community. And for our kind of area of expertise here, careers, going back to school, going back to work. People coming into services might use stigmatizing language themselves. And that might, again, reinforce kind of that illness identity. Families and other persons in the individual's lives may also use language that is promoting a more illness identity versus a positive role identity. It can be written, it could be verbal, and we'll talk a little bit more about that in a bit. As providers and supervisors who might be on the call, we want to encourage individuals participating in services, our team members, families, and others to consistently use strengths-based approach. So when we think about specific language, there are two references down here that I would suggest, digging into a little bit deeper, but think about, I'm going to pull up a couple of terms and think about what might be a more strengths-based language. So instead of using case management, what might be a more strengths-based terminology? The case management, kind of moving away from the term case, right? People aren't cases. Let's see. A care plan. Yep. So something like that, a care plan. What else? And like I said earlier, some of this is kind of nuanced. It's not just blatant, really inappropriate use of terminology, but it's language that we need to be mindful of. Stephen writes housing support. Yeah, so instead of, or it might be service coordination, right? So you can kind of see the difference. Again, it's not blatant in your face differences, but there is a different connotation when you move from kind of thinking about people as cases that need to be solved, right? We're really looking at coordinating services and supports, care plans. Justin's writing in the chat, the one that sticks with me is deal with instead of work with. They say two different things. Yes, Justin, do you want to expand on that a bit? And then Denise is writing wraparound support services. Yes.
Yeah, that's when I train case managers, I make sure that that's one thing that we focus on, because deal with connotates that there is going to be this equitable exchange.
Mm-hmm.
And that's not how social services is, and that's not the intent, right? And work with elicits that there's an investment from both sides, that we're working together for a common goal, whereas deal with is almost taking the humanity out of it.
Mm-hmm.
And it creates this power dynamic over others. And I know, and that's in all of this field, the scariest part is the power dynamic, because that's the most, delicate part of it all. So that one is one that we do that, and then should instead of could.
Mm-hmm.
We don't say should.
Yeah.
We say could.
But
One's
again,
a directive and one's a choice.
Yeah. And I think that it's, again, these aren't in your face, really something that you would immediately think about. But as you do think about that, even the term deal with, there's a negative connotation, like, oh, I have to deal with this, right? I mean, so aside from what you were mentioning, it also feels like it's like going to be something difficult to deal with, right? So I think that's important. I've kind of transitioned from, I typically I'll use job seekers or person participating in services and even moving away from receiving services. So to Justin's point, a person participating in services is a partnership. So all of that does matter. So, you know, compliance, you know, someone's not compliant. What, you know, do you ever hear those types of treatment type terms, like medical model related terms?
All the time hear those terms.
Yeah, Teresa?
Yeah, I hear those things all the time. Someone's not in compliance, go fix their
Mhm.
file or go talk to them. And you have to, I personally work on a way of, instead of, you know, hey, we didn't achieve this, how would you like to go about it?
Yeah. So yes, we didn't achieve this. Something in our plan didn't work out. How can we readjust the plan, your plan, our you know, our work together? So involvement, partnership, focusing on that. You know, there's no force, there's no you know, someone just sort of conforming. No, you're partnering with someone. This is their adult role. Janice, did you want to say something a little more?
I just want to say that I'm involved with like Camden Coalition, so I work, you know, we work a lot in this area with the National Center for Consumer Scholars or Complex Care and Social Needs and trauma-informed care. I thought the deal with was very interesting, but I still hear adherence and compliance, you know, more often than I would want to hear. I really work at a national level too, around measurement and guidelines. And so it's interesting. I don't hear it very often, but sometimes it's hard to, you know, like I'll hear from a clinician, what do we do about non-compliant patients,
Mhm.
right? So we can say we can work with shared decision making, you know, to patient partner associate as that, but some of them, but they're really non-compliant, you know, they'll be pretty insistent on it. But adherence, and sometimes, you know, I mean, I think it's really about a discussion. So it is a partnership. I think you have to talk about it. And you know, some patients might you know, they might actually prefer that language, but same thing, I don't think we should be using it, right? Anyway.
Yeah. And I think just kind of what you're saying, partnership, cooperation, are all suggestive, sorry, of someone kind of taking responsibility of their own recovery. Let's see, there are more. So instead of consumer or client, you know, the role that is relevant to the position that you're working in, right? Job seeker, worker, student. Yes, Janice, I agree. I liked what Teresa stated as well. Let's see. Are there other terms that you can think of that just really reinforce a more illness identity instead of a strengths-based approach or a recovery or identity? Let's see here in the chat. Chelsea, we use participant instead of client or consumer, which is what the state uses. So again, participant, someone who is participating, partnering with you. Anything else that you want to share that might be helpful for others to kind of recognize that language and what might be a better term to use? So just kind of generally, let's see, there's something in the chat. Justin, in our department, we use citizen. Yeah, this idea of citizenship and everyone, you know, being a citizen in our community and all of the rights and responsibilities that come with being a citizen. So deficit focus, we've kind of talked about that. skills focus. So, you know, a lot of times treatment plans or other interactions with, you know, other providers are really focused on that deficits, what the person can't do, what, you know, what's the problem, instead of focusing on skills. And so if you come out of this with anything, it's maybe pausing and thinking, oh, do I really need to hone in or focus on that problem? Or is there another way to present this information to a colleague or family member? You know, again, not suggesting that this is folks on the call here, but that negative or judgmental tendency, and instead of a hope and optimistic view.
Tony, this is Dawn.
Hey, Dawn, you are here.
Yeah.
Hi.
I
didn't know
came
if-
in,
Yes,
came in
hello.
late, I'm sorry. You know, one of the things that when you're talking about kind of the negative and attitudes that seem, well, wrong to me, you'll hear staff talk about engagement
Mhm.
as though it's all on the participant and none of it's on them.
Yes.
And when I do engagement training with staff, I talk about a lot of it's you know, how are you welcoming?
Yeah.
Do you use person first language? Are the other people in your agency welcoming, including from the receptionist or whoever that front desk person is, all the way through? Does everybody make the person feel like they're wanted? You know, they're
Yes.
glad that they're here. And so engagement is one of those things that's kind of I think misconstrued too, that there's a feeling that it's all on the person. It's not. A lot of it's
fact-
on.
Yes. Go ahead. I think you were going to say the same thing I was just going to say.
No, go ahead, please.
Though, like you said, Dawn, in fact, it's more on the provider, right? It's
Absolutely.
our skills of engaging, and just to just repeat exactly what you said. Is the person feeling that they're welcome? You know, are people smiling? Are people open? Are they sitting behind desks versus sitting side by side next to the person? So yes, all of those kind of key communication skills matter. Janice, you have your hand raised?
Yeah, I was also thinking, I've had multiple eye surgeries, and so I very rarely look people in the eye. It's just from my childhood and
Mhm.
poor vision, right? And so people will look behind them and things. But when we're talking, you know, in this manner, we have to always remember that there are neurodivergent people, and they can be working in the workplace. You know, I had a PA that was acted, you know, very, what I would say, you know, kind of non-culturally responsive and not very astute in his language, I guess. I don't know. I mean, how he was just not appropriate, kind of. But I realized, you know, I think he's a little bit different, right? He's a little bit cognitive different. And it wasn't like I was wrong, but that's his communication level.
Mhm.
And we do have, you know, more and more individuals that are neurodivergent working in the workforce. And so sometimes we have to remember that, right? I didn't complain about it in that sense. You know, I just, whatever, I had another issue about it. But, and so, you know, people might think, you know, that I am sad or something. I might have my head down. So it's something that, you know, that's where you just, you know, you know, there's some intuitive thoughts here, and we all have judgments and biases, whether we, you know, want to disperse of them or not. And it still happens, right? So how I talk to people, if somebody talks to me the same way, I understand maybe, but other people might not, right?
I think that empathy, having empathy and showing empathy in the way that you can. Chelsea's mentioning, thank you for mentioning that. I am neurodivergent, and I can struggle sometimes with eye contact and others misunderstanding how I'm feeling about something based on my body language. Yes. So, you know, you're right. There may be other ways that you can convey that you're listening or convey that you're open. And depending on your level of comfort and how managing that bit of personal information about yourself and your in your role, you know, if that's something that you're confident with, disclosing or comfortable disclosing, that may certainly benefit you and the person that you're working with. Yes, Julia mentions even the term provider feels like a superior term. I agree. Are there other options to using the term provider? What are some options that maybe you've used or have heard or could consider? And not just Julia, and anyone. Let's see here in the chat. Carer is being used in some agencies.
It's mostly in writing. We'll write and carers, like
Okay,
patients and carers, and because that includes caregivers, providers, clinicians. This is so fluid. It's really up to the organization what they prefer, and sometimes it might help asking, how would you like to refer to me, right? Like using, our first names now we're doing much more often, and some people might not feel comfortable with that too, right?
yes,
But
yes.
asking, I think, helps.
Always a good idea, asking and using that. Julia, I let folks know that I am on their team and they are the lead. Yes, so even framing it in that sense, this is a team, you're the lead of the team, and I'm a support. I'm here to provide supports and resources and help you in your recovery. Yes, Denise, I'm here to support you. I love that idea about just the term, here to support you. You're the lead of the team. The person participating in services is the leader, and we're there as team members. Love it. So let's look at this activity, and I think we can do it in a larger group. We have a pretty manageable size. So what type of language do you sometimes hear in your organization? Whether it's verbally or in print or materials or online, what type of language do you hear within your own organizations? Are terms like client and consumer used? For peer, trauma-informed language, great. Person seeking support, Oliver writes client, okay. Member, Jamie writes. Community member, customer. So even just unrelated to the actual person, participant, Tina writes, what other type of service recipient, what other type of language, whether it's kind of verbal language among your team members, supervisors or administrators, patient, partner, is Janice writes in here. Job seeker. Does the language support a strengths-based or person-first approach? Are there bulletin boards or even online, the website? Does that language denote strengths-based and persons first? Justin, we focus on the fact that what we do is part of their story, not ours. Yes, and is that kind of advertised verbally? Do you all, describe that to the person? Advocate, yes. So Julia mentions having language like advocate, and using language like that, absolutely. So if there is language that is used and it's not strengths-based or person first within your organizations, how would you reframe or restate that so that it is more aligned with a strengths-based perspective? And then also to consider, how might the language used within your organizations impact individuals participating in services? And again, reflect on some of those earlier experiences that you shared. Would someone like to respond to that question? How might the language used within your organizations impact individuals participating in services? Oh, let's see. Dawn, when I hear one of my colleagues using other than person first language, I may share information about person first language. Yes, I agree. So sharing information, providing resources, all very helpful. So another, let's see. Justin, begin with asking yourself or asking of the person why they are using the language they are. First step is acknowledging that there is a problem with the social dynamic that is imposed. Yes, so maybe having those frank discussions. So as we're kind of nearing the end of our time here today, there's an activity that we can kind of walk through here, looking at the strengths-based principles here on the right, and then kind of some of these questions here, identify one of the principles listed. What is one way that,
Oh my God.
oh, Oliver, I think you might not be on mute. Thank you. What is one way that you can apply this principle with respect to your language? So this sometimes is a nice team building exercise. If you want to think about this as something to bring back to the team, these are some strengths-based principles. The helping process is focused on strengths, interests, knowledge, and capabilities versus deficits. This collaborative mutual partnership of power with another person. So it's not this power dynamic, but it's a partnership. Everything that you all just mentioned earlier. Individuals are responsible for their own recovery. We're not, we don't make those choices for the person. The person is involved and engaged in their own recovery and responsible. All individuals have the capacity to learn, grow, and change. Helping activities occurring in the natural environment, and the entire community is this oasis of a resource. Julia, many of the participants are already distrustful of agencies of all sorts. It's important to create an alliance, often through language. Yes, absolutely. So we won't have time today to review this activity, but using it as maybe something to engage other team members. Oliver, we have incorporated person-centered and strengths-based language, beginning with job descriptions, interview questions, education. Absolutely wonderful. So some references for today. We reviewed the person-first language, talked about illness identity, recognized and reframed language. Let's see, we have something here in the chat. So this culture is acculturated from the very beginning. Yes, Oliver. So people are expected to use this information. Please email me with any questions. And then finally, if I could ask if you could use the QR code here. We are conducting a survey of looking at some of the learning communities. And if you would like to take part of that, you can certainly capture the code here. Look out for a survey to be sent from the Foundational Community Supports regarding this. It's all anonymous, and there's, we it all went through our institutional review board. So it's done in a way that protects your confidentiality. So if you want to do that now, we would appreciate it. Please contact me with any questions. My email, I'll put it here in the chat. You can, if we didn't cover something sufficiently, or you have any questions, please don't hesitate to ask. I just sent that in the chat, and then thank you. I know Dawn usually follows up the trainings. I do have to go. I have another webinar at 1, so thank you. So Dawn, is there anything you wanted to add?
Sure. I would just mention, and thank you, Joni, very much. I'm so glad I got to attend today. I don't very often, and you do so well. I appreciate it. But I just wanted to share with the group that a number of people have recently gone through certified benefits planner training. There are going to be more certified benefits planners throughout the state of Washington soon. But for those of you who might want some, kind of informal and more abbreviated version of benefits planning training, Darren Paskey and I are available to do that for agencies. I believe strongly in the need for staff to at least understand the basics of benefits planning, so that we don't do helping people find jobs or things like that, so that they don't lose their housing or benefits that they haven't replaced with their wages and end up being in worse shape than when they went to work. So reach out to me if you'd like some training on benefits planning or for other issues, and make sure that you're on our newsletter for the trainings that we have on a monthly basis, including Joni's. Thank you,
Great.
Joni.
Thank you, everyone. Bye-bye.
Bye.